Well, there is a critical blood shortage still happening where the need has stayed, but during the pandemic, the donors have not.
KSBY's Aaron Fay found out blood donor centers are turning to a group that has historically faced barriers when donating. Good morning, Aaron.
Good morning, Janelle. Good morning, Neil. Scientists are looking to expand eligibility for the LGBTQ+ community, and they are saying that every blood donation is tested for viruses, including HIV. Scientists at Vitalant, one of the major blood donation centers, said there's a lot of unmet medical need due to a shortage of blood. And Vitalant is working with other major blood donor centers and the FDA to figure out how to increase the blood supply. Dr. Brian Custer is a scientist working on the project.
We need to attract and retain blood donors. So what's, of course, one of the major things that's changed is we no longer do frequently mobile drives. We used to go to things like schools and universities, and we're starting to do that again. But of course, for the last year and a half, we haven't been able to do that.
Eligibility to donate blood expanded during the pandemic. For many members of the LGBTQ+ community, there was a deferral process before they could give blood. That meant they had to wait a year after being intimate with someone in order to donate. But because of the pandemic, that deferral period was reduced to 3 months. Now scientists are working to abolish that time frame for men who have sex with men.
The ADVANCE study started planning a long time ago, actually several years ago, when there was a 12-month deferral for men who have sex with men. And at that time, that was recognized as clearly not being an appropriate policy, meaning that is asking people to, a certain group of people, to have a different set of rules. So at the inception, the ADVANCE study was intended to, again, collect data that could permit us to change the rules.
The study would include around 2,000 participants and give them a questionnaire, then their blood would be tested.
So we are using the combination of your answers on these test questions that might be on the donor history questionnaire and the actual testing that we'll do on the blood samples to figure out, are there groups that do have lower risk and don't have any evidence of HIV infection?
Scientists reached out to many local LGBTQ+ organizations, as well as did outreach in the community, including in other groups like local sports leagues, to participate in this study.
It's been a very great source for participants are people who participate in various sports leagues. So could be tennis players, could be bowlers, could be softball players, could be dodgeball players.
They expect the study to continue for the next 3 to 4 months and hope the FDA can get back to them by 2023. Live in the newsroom, Aaron Fay, KSBY News.